Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to another episode of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. We've got somebody I consider one of the best in the industry as a guest today. So I'm really excited to introduce all of you, if you don't know her, to Christina Malik. She is the founder and CEO of Core Consulting Partners. Welcome, Christina. Thank you so much for being on today.
Well, thank you, Jeremy. I appreciate the invite and I'm looking forward to talking today.
Yeah, so you've got an awesome story. I'd love for you to kind of share with the audience your history, kind of your journey to a year ago when you founded Core Consulting. I really admire it. And I think it's awesome for the audience to be able to understand and your background a little bit.
Thank you. So prior to what I'm doing now, I spent about 20 years in traditional healthcare operations administration, running medical practices, working under health systems. At one point, one of the practices I was looking for was actually interested in kind of opening a med spa, as was I. And so I ended up submitting an inquiry for a large med spa franchisor to be a franchisee. And midway through that call, or I guess at the beginning of that call, the chief development officer asked, "Do you want a job?" And I didn't really want a job at the time, but I took the meeting with his CEO anyway. Met the CEO, quickly realized it was one of the most engaging conversations that I had. And I was excited about this industry because I was a patient of the industry. So I ended up accepting the role of chief operating officer and general counsel of a large, that large national franchisor. I spent a couple years serving in that role, but realized quickly that there is a huge need for just legal and compliance infrastructure and support in this industry. So as someone who grew up in traditional healthcare, it was very regulated, right? The Joint Commission ruled the day. You had very strict standards. Everyone was aware of the standards. It was very black or white. This industry is the polar opposite of that. It's a lot of gray. There are no standards. There's not really an accreditation program, or at least there wasn't until very, very recently.
So just barely, yeah.
Just barely, right?
Yeah.
And there's just this huge need. And so I recognized that need during my time when I was at the franchisor. That said, I had actually accepted a role. So I was going to leave the franchisor. I had accepted a role as president of another brand, market president, but there was a miscommunication about my non-compete, which led me to the realization of, hey, why don't I hang a shingle? I will hang a shingle because I know there's this huge need in the industry and I really enjoy this aspect. So I hung a shingle almost exactly a year ago, actually. So it's been a year and like 3 days.
Yeah.
And
just
barely. The plan was not to stay doing this, but a few months in, I realized that there's nothing I would rather be doing than providing this type of support. Really being that first call that my clients can make when they're facing an issue or if they have a question or about a regulation change. And I don't want to go back to the operator seat, which was a very big realization for me. Having spent, 2 decades doing it, I had fully intended on going back. And I realized this is exactly where I meant to be. I love every minute of it. There's no Sunday scaries thinking about going into Monday. I look forward to what clients I'm talking to the following week. I proactively reach out to them to have conversations. I get excited about the work that I'm doing now and where this industry is headed. So that's the journey to where I am, and fully intended on going back in-house somewhere. But no, I'm staying firmly planted in the legal and compliance infrastructure here.
Very cool. And congratulations on that journey.
Thank you.
When I saw you were celebrating 1 year, I couldn't believe it because even though we didn't know each other when you started this, thanks to LinkedIn algorithms and all the people I follow and that you follow, I was like, oh, this Christina, like I really like her content that she's putting out. So I kind of followed you before we had a chance to even connect and meet each other. And so, yeah, congratulations on all the good you're doing and the success that you've been having.
Thank you so much. It's been an incredible year. I'm so appreciative of the industry connections that I made, at my time at the franchisor, and kind
Yeah,
of gave me the springboard I needed to do this. And just loving every minute of it, honestly. My grandmother used to use this phrase that if, you love what you do, you'll never work. And I
yeah,
always thought that was honestly sort of a dumb phrase because I'm like, that's not true. Everyone feels like it's work. No, it actually is true. Like, it's
yeah.
legitimately true. When you really love what you're doing, the days fly by and it doesn't feel like you're working. So I got to learn that over the last year, and it's been honestly pretty incredible.
Love it. Okay. Well, let's jump into a few of the topics that we wanted to discuss. I thought it would be good to get your perspective on, some of the common questions and things that I know our team hears in the industry, but also that I know you hear and come across with your clients as you're talking to people. So I wanted to focus on a few of those. The first one being good faith exams. You hear about them all the time. They're important. How much we need. How much they need to be done. There's a lot of misconceptions though about when to do them, when not to do them. And I thought it'd be good for you to spend a few minutes, what you're seeing out there as you're talking with clients, your groups where that maybe are falling short, when you see them falling short and you've got to re-educate them. I think that'd be a good starting point if you want to talk through that.
Yeah, definitely. And I agree. I think it's one of the areas that people stumble through quite a bit because they don't realize kind of what the good faith exam is intended to do and who it is actually for. So, good faith exam, which I recently learned is not a word, not a group of words we're supposed to use anymore. So, it's supposed to technically be medical clearance, although the entire industry calls it a good faith exam.
Yeah.
But I was stopped mid comment with a board investigator that is a quote made up term that our industry has created that means nothing. So, for a good faith exam, aka medical clearance, it's intended to be a someone with prescriptive authority kind of does a medical intake with a patient and clears them for services. It may be one service, it may be multiple services, but the point of it is to actually do this full evaluation of the patient, look at their medical history, look at what services they're interested in, and then essentially create a prescription for those services. So think medical clearance intake, can you have the service itself? The other piece of that is actually creating kind of a treatment plan in and around the services that the individual selected that they wanted. And then if states require it, sort of that standing order that has to exist for other people to be able to execute on.
Correct.
What I'm seeing when I talk to a variety of med spa owners is that their perception is that clearance is only required when they're doing hormone replacement or when they're issuing any type of peptide or what they would consider like a traditional prescription. And I'm like, oh no, like you have to do this medical clearance, this good faith exam for any prescriptions. And then again, their mind goes back to, well, we're not doing weight loss right now and we're not doing HRT. And then there's this piece of education that has to exist of, well, Botox is actually a prescription and filler is a prescription. So if you have registered nurses or estheticians in states that allow it performing medical services, this good faith exam has to happen before those services are delegated to that individual. So that's somewhat, I think, either unclear or maybe there's misperceptions out there of what the good faith exam is and who it's for. It's really any time a patient is having services that are going to be delegated to a registered nurse or to an esthetician, that good faith exam has to exist. Now, when a nurse practitioner or physician assistant is doing the intake and then subsequently performing the services, is it necessarily needed? A medical evaluation and clearance is still needed. Now, do we need to call it a good faith exam and put together a treatment plan and standing orders? Probably not. Is it best practice to still have those exist in case you do want to delegate to a registered nurse? Yes. But every patient needs to be cleared for services before they have them. And if someone other than a nurse practitioner, physician assistant, or physician, I guess, too, is doing the services, that has to exist. It has to be documented in the EMR, and you have to have all three components of it: the clearance, the treatment plan, and the orders. And then from there, an RN or an esthetician or an LPN, et cetera, depending on the state, can execute against those orders. So that's the biggest thing I'm seeing is that there's people are unaware of what really is a prescription. And Botox and the like, they're all prescription drugs.
Yep, those are the ones that we see missed all the time too. Like it's that's the procedure. When people who don't know the industry think about the industry, like Botox is usually the first thing they're like, oh, I kind of know what Botox is, and so because it's such a basic. When I say basic, I mean that's unfair, but because it is kind of like maybe the initial thing people know that about the industry, they don't think about that it is still, yes, it's a prescription. It's not just this treatment you're getting. It's a prescription that needs to be handled the right way. So I think that's great. Yeah, that is a common one that is missed, and that always requires education as well for our clients as we talk with them. Um, the other thing that was interesting. So we were both at the AmSpa show this year, and a theme over the last couple of years has really been compliance. Compliance has been a big theme year in, year out. And a lot of it is, I think, because as the industry matures, people realize, okay, and people that are serious about the industry all desire for the industry to start to have some standards and compliance. Nobody wants those headlines that you see out there, and I call them bad actors. I don't know, that maybe maybe a little strong, but the people who have given the industry a bad name, right? You see these stories, you see news stories and headlines. Nobody that's serious about the industry wants that. They want patient safety. They want things to be done the right way. And so that's been a huge theme. But this year, it kind of, I think, upped the ante a little bit because the FDA showed up to AmSpa. And I think maybe to the surprise of a lot of people. But I thought it'd be great to get your perspective and what you're seeing, why the FDA showed up. What are they talking about when it comes to med spas? Specifically, is a mouthful, the Drug Supply Chain Security Act, that they spoke about. I thought it'd be good to have you educate our audience on why this is becoming more of a focus.
Absolutely. So I equally was surprised that they were there. I mean, of course, I had seen the lead up to AmSpa where they were doing the announcements and then they actually said who it was that was coming, et cetera. But I loved to see that they were there. AmSpa is what, 8, 9 years old. And this is the first time that the FDA was actually there. And I think it's an incredibly powerful thing that they were there to form a partnership with a large government entity that, that can share what it is that they're looking for and how it is that they think of med spas broadly. I think can only, better the industry, right? I really care about protecting the integrity of the industry. And with that, there need to be standards. There needs to be an accreditation process for med spas to go to keep us all safe and not only protect the patients, protect the providers and their licenses, but just protect the integrity of the industry that we're all working inside. So I loved to see them there. I did hear that there were a lot of people who were asked, Alex and others from AmSpa, like, what the heck are you doing? Like, why did you invite the FDA here? Why are they coming? We
You're
don't
putting
need
a
their
target on
eyes.
our back.
Exactly. And I'm like, no, like you should want them to come because you should want to know what good looks like. Yes. And who better to tell you what good looks like than the people who are actually coming in to do the audits, right? And so they came, they put on a great presentation. I attended their session. It was well done. And like you mentioned, one of the things they talked about was the DSCSA, so the Drug Supply Chain Security Act. I always kind of mess up the wording of it. And what that is where are you getting your drugs? Where are you sourcing your drugs from? I have had clients reach out to me and ask, hey, can I buy drugs through this GPO? I'm like, let me find out what are the details of the GPO. Yeah. Who's the GPO through? Like, what does that actually look like? Typically, GPOs are very formalized. Do you have documents, et cetera? And it's like, no, she's on WhatsApp. She just reached out and wants to know if I want to do part of this order. And I'm like, 100% no. Like, no, you can't do that. There are legitimate GPOs that you can buy through, but most of them that you're doing inside text on a WhatsApp group chat are not legitimate GPOs. So what they're really looking for, and in the case example that the investigator went over is, they went to a med spa, they were going through the trash, which when I tell my clients is always like startling to them. They went through the trash, they found an unmarked white vial that was white labeled. I don't think was clear on what it actually was from a substance standpoint. They took it back to their lab, which I was impressed by, and figured out that it was essentially neurotoxin. They then got access to what that specific med spa had ordered from manufacturer, and they got access to their EMR, and they compared how many vials of Botox, essentially, did you order versus what you sold. And they realized that what you actually ordered and sourced legitimately from Allergan is not what it is that you sold. You sold significantly more units than you purchased in the duration, in the time period that they looked at. And it was pretty significant that they indicated, meaning you sourced your drug from somewhere else. Well, we know you did because we have this white labeled vial that ended up having substance that was neurotoxin in it. So, they ended up citing that med spa for the first time. And FDA cited a med spa for a DSCSA violation, which means that they did not source the drug correctly. So in practice, the tax ID essentially that's buying the drug and the tax ID that is selling the drug should be the same entity usually, unless you are buying through a GPO, et cetera, but it should be the same entity. And that needs to come from a US approved manufacturer, distributor, warehousing. It can't be a third party. You can't source it from overseas and then subsequently sell it here, right? You need to sell it through an FDA approved channel, which means you need to track the serial number, you need to track the lot number, you need to make sure that you have the records of how you purchased it on file. Back 2 or 3 years worth of records, you need to be able to show that this is where I got my drug from, this is the associated lot numbers, serial numbers, etc. And you have proof of that. So it's not as simple as like, well, I have that, in my EMR. You need to actually have the invoices to be able to prove that you bought it from a legitimate source, and that same lot number traces all the way back through who it is that you injected it in, and then you can actually pull that if you need to. So that's another kind of weaves into documentation to some extent. You need to be able to actually pull that in the event of contamination record or in the event that manufacturer reaches out about an issue. So getting it from a direct, legitimate source, tracking it appropriately, lot number, serial number, expiration, et cetera, and then documenting it appropriately in the medical record so that you can trace it all the way through from the time you bought it, how it was manufactured, to the time it was used in a patient.
Yep. Love that. That was a really good explanation of the situation, the problem, an example. So thank you. And again, we could probably spend 30 more minutes just on that, which obviously I'm not going to do today. Last thing I wanted to ask you. So we've talked about good faith exams, the FDA, and I know, and you see this, and I know our team sees this as we're talking with groups, but a lot of times people come to us and they're like, I just don't know what to do. This feels really hard to get compliant, and I'm worried it's going to be really expensive, and I just, what do I do? And so I wanted to maybe get your feel at what you're seeing out there. There's a perspective, I guess, in the industry that compliance might be out of reach, that maybe it's too hard, it's too expensive. And even those that want to do it, they're a little bit hesitant to kind of get going down that road because it does seem overwhelming. So maybe put people's minds at ease, a little bit, and I can help share in that too. Obviously, as both us and you are trying to help these groups.
Definitely, and I would agree with you. I think that's one of the most common things I hear from operators is that they're doing 9,000 things at any given moment. They're juggling so many things, and as a former operator, I appreciate that because I was in that seat. I was in that seat as a COO of a large practice, and then I was sitting in that same seat as a COO of med spa. I completely understand and resonate that you're doing so many other things. Compliance often falls to the bottom of that list through no one's fault. It's just when you've got providers who are quitting, or they have called off, or you have an upset patient, or you have a chargeback, there's a lot of other priorities that compete for attention. And then compliance tends to fall off day over day. And then at some point it feels insurmountable. It's, well, I haven't been doing these things, and I'm just going to put it under the rug for now. I'm not going to think about it. Right. And like out of sight, out of mind, ignorance is bliss type mentality. And then someone comes knocking and they show up and they do an unscheduled audit or inspection of the location, and there's an issue. And that issue could have easily been prevented. That potential fine, right, which could be high dollar figure, could have been avoided if there were things in place. But to an operator, it can feel insurmountable. And it can also feel that way from a cost standpoint. Well, compliance is so expensive and time consuming. And what I tell my clients is 2 things. One, compliance, you're never going to get 100%. Right? We can get you as close as possible, but it's not going to be measured in 100%. It's going to be measured in what did you have in place? If something happened, what analysis did you do in order to make sure that that never happens again, right? Almost like a root cause analysis to prevent any patient harm from happening again. And how much time and attention are you putting into this, and how educated is your team on it? It doesn't have to be an hour a day, every single day. 7 days a week. It can be measured by having structured meetings and having, a monthly call with me where we're talking about new issues, etc. And so I put together almost like an audit package for my clients, and it's very low cost. I usually will come on site. There's additional costs obviously for going on site, but it's a very rigorous audit process where we go through and we talk about good faith exams, and we talk about the DSCSA, and we talk about how it is that they're doing things inside the room and whether that matches the protocols that they have documented, if they even have those documented, right? And so it's this comprehensive audit approach of what are you doing? What is missing, right? So red, yellow, green, like these are great. These could use some work. This is missing. And putting those things in place to get them to a place, to be in a really good place and have that as like your starting board for future compliance. So many people think that it's just not achievable, but it is definitely achievable. It can be done over a period of 30 to 45 days. And what regulators are looking for is that you are aware there was a potential issue, you put things in place to correct those, and you have a process for monitoring it going forward. And I put that all together with my clients for, relatively inexpensively, and will continue to educate them along the way. Because again, it's never going to be 100. Compliance is changing in this industry, what feels like daily. So it's a matter of where are you going, and making sure that any needs you have along the way that are met with various documents or new systems or new protocols.
Love that. We've definitely found, not even just in the med spa industry, but healthcare, abroad. We've had lots of clients that, get audits and have inspections come through. And what we found is, these agencies, what they're looking for is, are you trying? Like, honestly, do you take this seriously, and are you putting forth your best effort? Because they know you're not going to be perfect. In fact, if they come in and the first thing you hand them is that you're perfect in everything, that's the red flag that they need to say, okay, you're not taking this serious. And so you should document, yeah, we had this issue, and then we did this to fix it. We updated our policy or something. We did additional training, and that was our corrective action. That's what they want to see. They want to see that you care. It's all about, the buzzword is culture of compliance. They're looking for a culture of compliance. And so, people like you, it can be really valuable for these groups. And again, it can be a really low cost, right? The software that we offer with the support is really low cost, for these groups. And it's intended to just help them manage it and actually feel like I can do this and it doesn't take all my time, so I can still grow my business and do it the right way. So I love that. You're doing great work.
Thank you.
It's amazing to see. So for those that are interested in talking more with you, what's the best way to get a hold of you, Christina?
The best way is probably email. So I have a website, coreconsultingpartners.com, and people can reach out that way. But my email, I'm a technology junkie, so I'm connected pretty much 24/7. Just first name, Christina, at coreconsultingpartners.com. And then, I can engage from there. I usually always give my cell phone number to my clients. I always tell them, I want to be your first call, not your last call. I want to install the sprinkler systems before any fires happen, right? So like, don't call me when the house is on fire. Let's make sure that we do everything preventative in nature so that you don't have to worry about that. Let that worry come to me, because you're busy doing 9,000 other things.
Yep. Okay. You did awesome. This has been a great episode, really valuable. Christina, thank you so much. We'll just have to do it again. You're a natural at this. So
I don't know about that, but thank you very much. I appreciate the invite, and it's been great chatting with you.
Yeah, thanks, Christina.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwinn@hcp.md. Don't forget to tune in next week. Thank you.